really appreciate the opportunity to be here, and I really want to thank you on behalf of Gallagher for the opportunity to sponsor this webinar today. It means a lot to us to consider part of the team here. You know, I work with agriculture all throughout the Midwest and have kind of been coast to coast as well with our clients. And the things I know about people in agriculture is they are extremely resilient and resourceful. And I really appreciate all that's going on within agriculture, how we maintain an effective food supply. As Heather mentioned earlier, we are one of the primary resources that we need to have up and running so that during this time when so many people are staying at home and inconvenienced by all of this, that we have a constant and healthy food supply. One of the questions that we are getting, of course, in the insurance industry is, what about workers' compensation insurance for those individuals who are sick? Well, so first of all, I want to always caution you or consider that if you have questions about your workers' compensation policy or any other policies, that you are in constant communication with your carrier or your insurance broker. Each policy is a little bit different and specific language is covered in each one of them. But generally, compensable work comp claims are likely to come down to whether or not the disease is considered occupational or not. So in order for it to be compensable, the disease would have to be contracted during the course of their normal employment. And in addition to that, due to conditions that are very specific to the employee's work. So we can look at the example here, healthcare workers, first responders, and so on, where they have a direct contact with individuals who may be sick and may have the exposure. Those individuals would most likely be covered. Those who would have incidental contact or no different contact than they would have in the public would probably not be covered. But again, you certainly want to cover those with your carrier or your broker. One of the other questions I get has been in regards to OSHA, and some of that involves record keeping, and similarly to to the workers' compensation insurance, if it's directly related to our workplace activities. For instance, caring for individuals, if you're in a high-risk area where you're caring for patients and so on who are ill and we're having direct contact from that, most likely that would be a work-related exposure, whereas agriculture would generally be considered a lower risk because it's not part of our job duties to care for people who have the COVID-19 virus. There's a lot of guidance provided by OSHA on developing and preparing a workplace to deal with situations like this. So I would want to point out here, there's a guidance for preparing workplaces for COVID-19. Great resource for any industry, but I think that it can certainly be applied to agriculture as you look at some of the features in this or steps to be taken in preparing our workplaces. So under that guidance, we could look at the fact that one of the things we want to certainly do is to develop an infectious disease preparedness and response plan. And of course, the time is now for that. We are well into this, and it's emerging and changing rapidly, and so we want to get ahead of this as much as we possibly can. It's time to prepare and implement an effective infection prevention control measures in our work sites and to develop policies and procedures so that we can promptly identify any individuals in our teams that may be coming sick and showing symptoms, or if they're not feeling well, certainly encouraging them to stay home, not only for their own benefit, but also for the workplace continuity. To keep our businesses up and running, we've got to keep everybody as healthy as possible. One of the things I know working in agriculture for as long as I have is that there's a lot of tough people out there who will come to work no matter how they're feeling because the job's got to be done. Well, in this case, it's really important for those individuals to stay home and leave the work to somebody else until they get to feeling better and free of symptoms, and follow the guidance of their doctors before returning to work. We need to develop and implement and communicate workplace flexibilities. A lot of the things that we're going to need to do to adapt our businesses is to provide some flexibility. It's not necessarily good to do things the way we've always done them, because we're missing some of those steps that are going to prevent that illness and virus from taking hold in our workplaces. And then we can implement workplace controls. And along the way, we need to make sure we're following other safety standards so that we can always keep our employees safe and healthy. So I think the most effective way to do this right off the bat is to develop a task force. And certainly we need the leadership of our employers right up front on this. They need to take the leading role, and then to encourage all their frontline employees to become engaged as they help to understand what the risk exposures are within our operations. And so we've got to really engage everyone in this, understand the exposures, where there's potential for exposures that we may not be looking at on the surface. So digging right into that. And then the next step is to complete a risk assessment. And you know, the CDC and the EPA have some fabulous guidance out there. The CDC, and we've heard from the other presenters about those resources. They're there, but we need to be able to adapt those recommendations to our individual workplaces. Our conditions are different than an office setting, and so we've got to be able to, you know, telling people to stay home and work from a desk, that's not really going to work here. It may for a few people, but we've got a lot of other people who we depend on to be there each and every day, whether it's milking cows or helping mama pigs deliver, or mama sows deliver piglets and those kinds of things. So we hear a lot about social distancing. And I think I've heard over the last few days, maybe thinking about rephrasing that into physical distancing, because we don't want to separate ourselves socially from our coworkers and our neighbors and our family, but we need to develop that physical distancing so that we're not sharing that exposure to disease. So we got to look at those processes that bring staff into close proximity and figure out, okay, how do we prepare them and set up workplaces so that we can spread that distancing out between employees. Looking at the shared tools and equipment that our employees use on a regular basis. I think about like a tractor repair shop where we've got mechanics in there keeping our equipment up and running at all times, and they're sharing tools and equipment on a regular basis. And so how do we manage that? And we've talked a lot about personal protective equipment, and I know Charlotte's got some more information to share with us on that, but we need to make sure that it's not just N95 dust mask, it's the boots and gloves and face shields and all those other things that we use that sometimes get used pretty commonly and shared with different employees. And what about shared vehicles and equipment? You know, there's a pickup or a tractor or truck that gets shared with a number of different people throughout the day. And of course, then those common spaces like locker rooms, offices, break rooms, and kitchens, and so on. Once we've done that risk assessment, then we need to adapt some best practices to mitigate the risk. So based on that risk assessment and using a hierarchy of control, then we can start to manage those exposures. We need to consider eliminating exposures where we can. And a lot of that can be based on providing that separation of some distance between employees. Maybe we need to stagger shifts, stagger meal times and breaks, all those kinds of things. I always enjoy going to lunch with, for instance, in a hog farm or dairy where we've got a lot of people coming together at a noon break, and they're all kind of sharing lunch together. And that's a great culture, but now is not the time for that. And so we need to figure out how we manage that and break that down so that we don't have that constant exposure. And again, along those same lines, where people are sharing meals and preparing food and things like that, that we're using really good sanitation, really stepping that up. And then, of course, we've talked about the personal protective equipment. One of the things that I see in some of the farms I go to is, you know, we have a boot room full of boots in a hog farm, and you just put on the size that fits you. Maybe it's time for every employee to have their own and keep them sanitized every single day. And the same with gloves and things like that, so we're not having cross-contamination between our employees. And finally, then working at implementing workplace controls. I think this is a critical piece now that we've got the information. Engineering controls are really not appropriate here. Those would be more for like a hospital setting, but we can start to look at those administrative controls. And we've already touched on those, the staggered shifts, communal meals, and physical distancing between employees. And then looking at those safe work practices, disinfecting the tools and equipment, frequent hand washing. One of the things that I can tell you is in many of our operations, the hand washing facilities are a fair distance from each other, and there's not that many. So maybe we need to step that up and increase those opportunities. If we don't have soap and water, that we have the hand sanitizer and those kind of things. Maybe we put hand sanitizer in all the vehicles so people have them with them all the time. And then really increasing and maintaining then the sanitation of our work facilities, our break facilities, showers, locker rooms, and that kind of thing. And again, that PPE, knowing when to use it and why to use it, and preserving especially the respirators and N95 masks. And finally, then we've really got to step up the training on our staff. We need to continually communicate to them and really emphasize the why of what we're doing. That number one, certainly it's to keep them and their families healthy. And to number two, to help them understand that they are truly crucial for the success of our methods and procedures in keeping a safe and healthy workforce and maintaining operations, and then monitoring and managing where we've come from and where we're heading to. We want to make sure that we're over communicating that information back to our employees, back to our staff members, making sure that everybody understands as things change, keeping them updated on progress that's made or critical areas that need more attention. So to wrap up, I want to thank you again for the opportunity to be here today. Again, on behalf of Gallagher, I want to thank you for the opportunity to support this important work, this information, to get it out to our ag producers throughout the country. Keep in mind, if you have any questions about your insurance, to make sure you're reaching out to your agent or to your carrier so that you can have the proper guidance on that. And with that, thank you, Natalie. I really appreciate it, and I'll turn it over to the next speaker.
Thanks so much, Mike. And the private-public partnership here is so important. You can see why you need to contact those companies that you're working closely with. They have great resources